So now we're going to look at a systematic approach, a step-by-step guide to how to break down scenarios and also answer questions. So there's 5 major things we can do. So firstly, identify your role, act how you should rather than how you would personally, identify the stakeholders and figure out what the important issues are in the scenario, and lastly, choosing a response option. So let's start with identifying your role. This is definitely the most important thing you could probably do in any one scenario. So in the SJT, there's 5 major character perspectives that you could take. Firstly, non-medical, so whether this is a student or a member of the community, a medical student, a nurse or an allied health professional, a junior doctor, and a senior doctor, whether that's a clinician or a consultant. So these roles are really governed by responsibilities and capabilities, where every different role has a different level of responsibility, a different level of capability, and this is really going to indicate how we should react in a given situation. And we're going to investigate this now. So firstly, a non-medical person, so yourself, a student. What are our responsibilities? They're not none, because we do have the responsibilities to still, uphold the values and virtues of what junior doctors should have or what you should have in the future. And this might include, say, integrity, professionalism, and trustworthy traits. So when you're answering a question, say, that's to do with plagiarism, we don't necessarily want to be condoning plagiarism in a high school environment, because that's not something that a junior doctor or a doctor would do. So just keep that in the back of your mind when you're answering questions. Still try and uphold these good character traits rather than how you would have acted in high school. I know that I wasn't that well behaved. Next, we have capabilities. So as a non-medical person, what are our capabilities? So in terms of these type of scenario type questions, quite limited. However, you can still be a support person to your friends and to your family. So moving on to medical students. This is a really important one because as a medical student, dressed professionally on a placement, you may be seen by patients as knowledgeable, part of the medical team, and actually may be seen as a junior doctor. So you really do have the responsibilities to uphold good medical practice and codes of ethic guidelines. This may include having respect for gaining informed consent or confidentiality, but also maintaining professionalism, whether this is dressing appropriately or behaving appropriately when we interact with patients. But obviously the major difference between being a doctor and being a medical student is your limited capabilities. You're still in training, you're still learning, and you don't have the capabilities that a doctor has to deal with many situations. You should always be identified by your student name badge or identify yourself as a medical student rather than as a junior doctor. So what's important when we consider capabilities? Well, you're still training, so you must be supervised, but you still have the ability to liaise with medical staff and doctors on behalf of the patient. And next, provide support and health literacy. So this is limited, but it is still something that you can do. So if you ever come across a scenario or a question, don't discount assisting a patient within your capabilities. So next we're going to move on to allied health professionals and nurses. So the responsibilities of nurses and allied health professionals are really similar to that of medical students and doctors. So upholding confidentiality, upholding professional behaviour, and that sort of thing. However, when we talk about capabilities, the knowledge, procedural and clinical skills of nurses are probably far superior to that of medical students and maybe even some doctors. So I think it's great when you really consider that and show respect towards that when you're considering what option to choose in regards to a question. However, there is a limit to the difference between a nurse or an allied health professional and a medical practitioner. So obviously they can't prescribe, they can't do certain procedures, and there's obviously certain capabilities that are superior of a fully qualified doctor. And lastly, that brings us to a junior doctor or a senior doctor. We have responsibilities, so as we said before, full level of responsibilities, and really remember the ethical principles here: beneficence, non-maleficence, and justice that we discussed in a different video. And lastly, capabilities. So really consider junior doctors as having full capabilities. So really take responsibility for that patient's care. Don't delegate to another doctor. Don't delegate to a medical student. Really be responsible for that patient's care and promote their patient safety. However, this last point here, when we do have a senior doctor, we might have someone that has a little bit more ability to delegate in regards to a junior doctor who should really accept that responsibility in regards to SJT scenarios anyway. Next, we have should versus would. So really this is the concept we've just been covering. So given your role, how should you act versus how would you act? So the SJT is an aptitude test, not a personality test. So act how you think you should act given your role, not how you personally would act. So in medicine, this is really guided by the foundational basis of good medical practice guidelines and codes of ethics. If you haven't had a little squiz of those yet, you may do so. If not, just watch our other videos on our summary of those. So let's talk about a mini example. So we have Emily. She's a medical student on placement, but she's forgotten her student badge. A nurse, assuming you are a doctor, has informed you of a patient, Billy, his lab results. So as you pass Billy's bed, he appears anxious and asks you for his results. What do you do? So in this circumstance, you might think that he has the right to his own information, which he does. However, you might need to consider, as a medical student, are you the right person to be able to give these results? You may be able to help him interpret them with health literacy, but are you able to deal with the pitfall if he needs some further explanation, or if he needs some psychological support, or the treatment options? You can see that it starts to get really complicated. So you can imagine that this probably isn't the most appropriate or even an appropriate response to give Billy results. And something you could do as a medical student instead would be to go get someone that's fully qualified and get them to, provide this information for Billy so that they can fully address any concerns that he has afterwards. So moving on, we have addressing stakeholders and identifying issues with the scenario. So what is a stakeholder? A stakeholder is basically just anyone that is potentially affected by an outcome or has interests in an outcome. So for example, a patient, their family, the doctor, or even the institution like the hospital or even the clinic, or even the wider community. They're all sort of stakeholders. It really is going to be scenario dependent though, but it is really useful to be able to identify these in the scenario and also relate this back to what your role is. So what is your role to the stakeholders? If you're a doctor and one of the stakeholders is a patient, you obviously have a doctor-patient relationship, whereas in converse, if it's just a schoolmate, you're just two non-medical personnel, and really it's just about being a friend and being supportive. So it's all relevant. Just a little note before we move on there though, the doctors have a responsibility to protect and promote the health of individuals, but also the wider community. So also keep that in the back of your mind when you're thinking about stakeholders. Next we have identifying issues. So what are issues? So really just identifying the major problems in the scenario. The scenarios in the SJT usually aren't that complex. There's usually just one major scenario, maybe one major scenario and a secondary issue. So what I think you should do here is really just identify the major problem, how you can address that, but also maybe in the back of your mind, look at the secondary problem, but also understand that it may be a distractor. So if you're thinking about how the medical student's feeling, rather than patient care, you should really be putting patient care first, and then how the medical student might be feeling, maybe secondary. So last point there, patient care, confidentiality, and patient safety are always the primary concern. So another example, here we have James and Anita. They bring their 3-year-old boy Samuel into the clinic over the weekend. The family has returned from overseas and Samuel has returned to daycare. However, he has recently become very ill and showing signs of a skin rash. You find that Samuel has not received his routine vaccinations and you are worried that he has a highly contagious infection. This is way more complicated than what the SJT is normally going to have, but I think it illustrates my point quite well. Whereas we have multiple stakeholders here. We have Samuel, the patient, so we're going to be promoting his care, his safety. It's really paramount. But also his parents, they have parental autonomy and they're worried about their son. They definitely have an interest in this scenario. The daycare center and the clinic, There's many people in both of these institutions that have now been possibly exposed to a contagious infection, and also the wider community in terms of contagious infection, but also in vaccination and protection of the wider community. What are the issues here? So as we just said, Samuel's health, risk to others, maybe the growing risk and levels of anti-vaccination that are occurring in the community. You can see here that there's multiple different aspects to this scenario. But some of the things you might be wanting to think of primarily, firstly Samuel's health, and then the health of other people that might have been infected. So that's all for this one, but make sure you check out the next video on should versus would for how to determine response options. Cool.